A lot of time parents feel that they are at fault and they've done something wrong. But autism spectrum cannot be caused by faulty parenting.
Hi, I'm Dr. Dhanwanti, and you are watching Anatomy of Bias.
So I had a 15-month-old girl who came to me with her mother for a well baby check and her vaccination. I noticed that she had very poor eye contact during the consultation. She wasn't using gestures or any non-verbal communication. So I told her mother that I had some concerns about her development and I wanted to refer her to a specialist for a more detailed assessment. But immediately her mother said that her interactions with her child were limited due to her busy work schedule.
So the mother had realized that there was possibly something different, but she had taken the blame on herself and attributed it to her own busy schedule and priorities, work, etc.
She hadn't read too much into it till I brought it to her notice at that first visit. Then she kind of said that, I'll spend more time and I'll teach her. I have not taught her yet, so she kind of took the blame on herself. So this child then came back to me at 18 months of age. This time, both the parents were present for the consultation. But I didn't see much improvement from when I had seen her last. She was not following even simple one step commands at the time, and I must convince them to go for therapy. So again, now the father said that he spoke late as a child, and that is probably it's hereditary, and that's probably why the child is not speaking, up till this age. By then, some of the extended family had been informed, so they were, putting a lot of pressure on the mother's parenting skills or parenting techniques. So she was on this guilt trip, and she was just not ready to accept now that there was a problem. She was in complete denial mode. This child eventually started therapy a little before she was 2.5 years. So there was a long lag, almost 9-12 months between, say, suspicion of autism spectrum and eventually starting therapy, which is really disappointing because early intervention is the key to prognosis.
How common is this level of denial amongst parents and other family members who also contribute with, explanations like, oh, you also spoke late? They might be telling the father and they kind of rationalize it that way. How common is this level of denial?
A lot of parents feel they have to teach their child to speak, which is not the case, because language is not only about the spoken word. It's also about non-verbal communication. It's also about using gestures, using your body language, pointing, shaking or nodding your head, emoting your feelings. And these things are not taught, they're not to be taught. This a child is supposed to get from his or her environment. So I don't, a lot of time parents feel that they are at fault and, they've done something wrong. But autism spectrum cannot be caused by faulty parenting.
Is there ever a blame game between parents that this might be from your side of the family or my side of the family because there's so little understanding about the nature and the etiogenesis of autism?
Well, blame game is more, I would say, about, how much time you are spending with the child. So parents will, kind of say that, you are not interacting, how much time each parent is getting in, taking out to get involved in the child's day-to-day life. And, how someone will say that the grandparents are using the TV all the time, and so the child is watching TV. Or the grandparents would say that the mother doesn't spend time, she's on the phone all the time, so how will she know what's happening to her child?
Like these parents who were in denial for such a long time, do you think it's a very common thing that the awareness level is very low?
So I think now over the last few years, we are seeing increased awareness. There have been a lot of social media influencers who speak about autism. There has been more awareness even among pediatricians and other clinicians who see these children. When you speak to them, at least they've heard the terminology. It's not something out of the blue. The outcomes can be really good if they get therapy at the correct time, and the parents are enabled to take care of these children in a slightly different way. That's all it takes.